This is Robert. Robert has been experiencing fatigue, poor balance, and a weak grip lately. After consulting his family doctor, he believes that he may have a neurodegenerative disorder called ALS. This is Mary. Mary has been recently diagnosed with ALS, and she has a lot of questions. What treatment plan should she choose? What additional medical tests should she take? She does not know what to expect since no one else around her has it. This is Dr. John. Dr. John is an ALS specialist. He has many patients and wants to be able to easily track the progression of their disease and manage the data. ALS is a neurodegenerative disease that affects as many as 30,000 people in the US, with no cure currently available. Introducing Neurognosis, the world's best telemedicine app for ALS patients and doctors. Patients can use our app to get an accurate diagnosis, personalized treatment plan, discover top doctors, ask a doctor online, and get expert advice. Robert can find out whether he has gotten the disease or not by uploading his medical history data and filling out a simple questionnaire. Our product is able to diagnose the disease on average half years earlier than the current method with almost zero false positive rate. Our app can help Mary by returning a detailed report that includes treatment suggestions and additional medical tests. With our huge database, by analyzing previous cases using our algorithms, we can predict the possible course of the patient's disease. Finally, our app will make it easier for Dr. John to track the progression of all of his patients' disease by organizing all of the patient data in a simple, easy-to-read format.
Here's how our product works. Our app is backed by a sequential pattern mining algorithm. In our development using Optum's EMR agnostic database, we utilize electronic health records, first standardizing our data and making it more efficient to implement into our machine learning algorithm. We use the established sequences from our sequential pattern mining to train our machine learning algorithm, where we concluded that the SVM algorithm was able to provide both the highest sensitivity and specificity, potentially shortening the diagnosis time of ALS by up to 169.2 days. Our product currently has two main competitors, WebMD's Symptom Checker and Ada Check Your Health. WebMD and Ada both function as symptom checkers and health managers, yet almost no app on the market targets the issue of neurodegenerative diseases. At Neurognosis, we're eliminating unnecessary ambiguity and anxiety surrounding diagnoses, raising the complexity and accuracy of current available solutions, reducing the time between symptom onset and official diagnosis, and creating what no algorithm on the market is doing. We're taking the electronic health records of past ALS patients, using this data with our sequential pattern mining algorithm, and identifying sequences of symptoms that appear in early stages of ALS. This technology reaches an entirely different field than any of our competitors, allowing neurodegenerative patients and medical professionals to quickly and easily pinpoint patterns, subsequently allowing for a faster diagnosis and lessening uncertainty and anxiety around the subject. When developing our Blue Ocean strategy, we identified 7 main aspects consumers will consider when deciding on a product. How general the app is made, doctor-to-patient communication, accessibility and ease, algorithmic customizability, whether or not the app was designed for and can handle the complexity of neurodegenerative diseases, proven neurodiagnosis accuracy, and advanced AI technology for advanced diagnosis methods and treatment. As conveyed through our strategy canvas, in our current market space, our product is hitting different pain points for different customers. We've forged a blue ocean market that functions separately from the current products and more effectively for our target customers. In terms of our target market, we've identified 3 tiers of non-customers. Our current, most immediate customers are ALS patients. Our first tier, soon-to-be customers, are doctors and hospitals. Our second, refusing customers, are insurance companies. And finally, the untapped market consists of patients of other neurodegenerative diseases. So, how does our business function? We've established that ALS is complex, taking 6 months to 1.5 years to diagnose. Neurognosis technology consists of a large database, something that we'll continue to build and improve our technology with, because of which we're mainly targeting insurance companies to purchase our service for their patients to use, which is pretty commonly seen with medical tools. Our go-to-market and growth strategy is as follows. To gain our initial user testing and user base, we're targeting national hospitals and ALS patients. Following this step, we hope to secure more hospitals and clinical insurance settings as partners to test out our commission model. Once we have solidified an official first version of the app, we will do a soft launch of our product and begin a beta testing phase. And finally, our ultimate long-term goal for this application is to expand our algorithm to be used for additional hard-to-diagnose neurodegenerative diseases. With these additional markets, such as Parkinson's, Alzheimer's, Huntington's, etc., we fully expect our market potential to far exceed $100 million. Here at Neurognosis, we're dedicated to improving the currently lacking experiences of neurodegenerative patients by creating more transparency with a quicker, simplified, easy-to-understand diagnosis process. Neurognosis, the future of neurodiagnosis.